put them in the Q&A box. And we'll save all questions until the end. We're just giving folks a few moments to join, so we'll let a few more log in before we get started. If you have any initial questions, feel free to put them in the Q&A box and we'll address them at the end. We've still got some folks logging in, so I'll let everyone come on in before we get started. We're just 1 minute past the hour right now. Okay, we will officially kick off. Thank you all for joining us today. My name is Megan Manning. I'm the Associate Director of Communications at Action on Smoking and Health. We are based in Washington, D.C. There's two Action on Smoking and Health organizations on this call, so we are the D.C. Action on Smoking and Health. We are separate entities, but same organization name. So today we'll be talking about the tobacco endgame landscape from global to local. Tobacco endgame is the policies that are working to phase out the sale of commercial tobacco products by a specific time frame. And so we'll hear about what's happening around the world, what's happening at the local level, specifically in Massachusetts, and then we'll hear about what's happening in the UK. There are multiple different policies that can all achieve a tobacco endgame, so we hope to share some of those with you today to give you all ideas about the different options available. We will hear from Chris Bostic, the Policy Director at ASH in the US. We'll hear from Katharine Silbaugh, Professor of Law at Boston University, as well as Hazel Cheeseman, Chief Executive at Action on Smoking and Health in the UK. So Chris, I will turn it over to you first to kick off for us.
Thank you, Megan. Let me pull up not seeing it here. There we go. Great. Does everybody see that? All right, terrific. Thanks, Megan. Thanks, everyone, for joining. I'm just going to give a very brief overview from a global perspective on what's going on with tobacco endgame. I'm very excited for this year. We'll see in a moment, but the number of in-place endgame laws in the world has more than doubled this year. And of course, the year's not over yet, and we're not done yet. I think you can expect some more to be passed by December 31st. So it has exploded, and I expect to see the momentum increase. So let's start with the United States. 2020 map was, of course, completely blank. And now we have, let's see, actually just going up last week. So 8, 9, 10, 11, 12, 13 endgame laws in place in the United States. And when I say endgame, it's kind of a squishy term, but when I'm talking about endgame in the United States or around the world, I'm talking about policies that either have outright banned the sale of commercial tobacco products, or have put laws in place that will phase out its sale over time, or have put laws in place that will phase out retail licenses over time. And so in all these cases, eventually there will be no more sales in those places. There were also last year 3 statewide bills for endgame, one in California, one in Hawaii, and one in Nevada. California and Hawaii both had a tobacco-free generation law up on the docket. This would have set a birth date by which, after that, anyone born after that date cannot be sold tobacco for their entire lifetimes. The Nevada bill was more complex, but it did include a tobacco-free generation component environment to it. Now, all three failed, but anyone that works in tobacco control knows that anything that's new fails the first time. And I think it's telling that it was even brought up and taken seriously at the state level. And we expect that in the next few years we will start to get some entire states that will do it. We also have active coalitions on Endgame in several states that you'll see on the map there, and you can expect some movement coming up soon. The city of St. Paul in Minnesota is intent on getting a nicotine-free generation law passed by the end of this year. That will be the biggest jurisdiction in the country to have passed that if it happens. And of course, the big action this year so far has been in Massachusetts. I'm not going to go into that because you're going to hear about that in depth in a moment from Kate. On the global level, this map was blank as of 6 years ago, except for a pin in Bhutan in the Himalayas. That pin is gone because they removed their ban on tobacco sales during COVID for fear that illicit trade would bring in the virus. So that has been taken away. But we've got a lot of other pins in, and I won't go over all of them. The red ones are laws that are in place. They're all in the United States except for Balanga City in the Philippines. That law is actually enjoined pending litigation by the tobacco industry. So that is not being enforced at the moment, but at least the law is on the books. The green pins are pins for countries that have set ambitious end game targets for prevalence. We call them the Aspire countries. The first one to do this was New Zealand. They're all 5% or less, but the year varies. It varies from 2025 in New Zealand to, I believe, 2035 in Finland. More countries are doing these every day. You'll notice there's a pin in the United States. Until last year, we had a 5% prevalence by 2030 goal. Last year, they realized they weren't going to be able to make that, and so they changed it to 6.1% by 2030. But unfortunately, there's still no national plan in place to achieve that. Most of the countries that have these green pins in them either have plans in place or are in the process of making them. And then the blue pins are places that are actively considering a tobacco-free generation. New Zealand actually did pass one 2 years ago, but unfortunately earlier this year, a new government rescinded that law in addition to other endgame laws in New Zealand. But of course, the horse was out of the barn at that point. Other countries took note of what New Zealand had done in 2022, and that has led to some efforts in other places. And you'll hear about one of the key ones in a moment in the United Kingdom. And then the orange pins are other end game type tobacco laws that are being considered, mostly about the environment. And I'll talk in a minute about a breakthrough that we had in California last month. And then the pin in Panama, in particular, I want to talk about. That was the location of the most recent Conference of the Parties for the Framework Convention on Tobacco Control, the Tobacco Treaty. And for the first time ever, Endgame was on the agenda. And the COP decided to set up an expert group between that COP and the next one to look at endgame policies and come back with a report on feasibility and the differences between endgame policies to bring to COP 11, which will be at the end of next year in Geneva. So that was a huge breakthrough. That's in 25 years. That was the first time that endgame was actively discussed at the tobacco treaty level. We also are getting an expansion in the number of groups that are supporting Endgame. When we started this, ASH was the only group that was actively in favor of Endgame, but we fortunately had a bunch of people, individuals from other organizations who joined our steering committee. And over the last few years, we've had some breakthroughs. There are now a number of organizations that support it, but I just want to highlight two. The first is the American Heart Association. 2 years ago, published their own white paper on tobacco endgame and what they think of it and how they're going to achieve it. And then just last year, Truth Initiative, which is the world's biggest anti-tobacco group by budget, came out with their own white paper on tobacco endgame. And I just want to give a shout out to both of these groups. They have been extremely helpful since the beginning in advancing the concept of endgame and helping us to raise awareness around the world of what we might accomplish through endgame. And then finally, earlier this year in April, we had the first National Tobacco Endgame Summit in Washington, D.C. Representatives from nearly every national tobacco control organization, as well as local, state, and federal public health officials attended. We were only able to fit about 100 people into the room that was donated by Kaiser Permanente, but we had so much interest. I think we could have had 500 people at this summit. A lot of people are now very interested in getting involved in the Endgame movement. I want to also thank thank people for the support that we had from that, Kaiser Permanente with the room, but we also had donations from the from Truth Initiative, from the American Heart Association, from ND Anderson Cancer Center, and from the Robert Wood Johnson Foundation. So thank you very much. And then finally, I'm just going to leave you with some news that has come out very recently. First, just last month, South Australia passed its tobacco-free generation law in their upper house of Parliament. The lower house of Parliament is expected to take it up in November. If that happens, it will be by far the largest jurisdiction in the world with a tobacco-free generation law. I believe they have 1.8 million people in South Australia, and we expect other provinces, other states within Australia to follow suit. This is just a headline from August in Massachusetts that the nicotine bans are becoming more popular. You're going to hear a lot more about that in just a moment. And then very exciting, just last month, the county of Santa Cruz, California, passed a law that will ban cigarette and cigar filters. And that is huge because unfiltered cigarettes are not used very often. I think it's less than 2% of the cigarette sales are for unfiltered cigarettes. So we don't know for sure because it's never been done before, but we suspect that it will be a driving force in quit attempts as people are faced with an unfamiliar product that is far less well, far more unappealing to smoke. We also think it will make children far less likely to take that first puff and think this is something I want to continue to do. So with that, I want to hand it back to Megan, and we'll hear from the amazing things happening in Massachusetts. Thank you.
Great. Thank you so much, Chris. It's really interesting to hear about the progress happening around the world. Kate, we'll now turn it over to you to hear more about the movement happening in Massachusetts.
All right. Do you see, let's see, let's make that a slideshow. All right. So my name's Kate Silbaugh. I'm a professor of law at Boston University with an interest in youth in general. Not a public health scholar, but I have also been an elected official in a town in Massachusetts, town of Brookline, that was the first in Massachusetts to adopt what we call the nicotine-free generation law. So the nicotine-free generation law is a birth date phase out, and it separates those who already purchase nicotine legally from those who do not yet use nicotine. In Brookline, that date is January 1st, 2000. After that birth date, you will not ever be able to purchase or be sold to in Brookline. And the other Massachusetts municipalities that have adopted the rule, their birth date is January 1st, 2004, in order to maintain the principle that if you can currently have nicotine sold to you, then you will retain that ability. So we passed this in Brookline, and I just want to show you, let's see, can I turn to the next, where we stand right now? I don't know if this, can you see this next slide? The map?
Yes, it left presentation mode though.
Oh, did it? There we go. So this map shows the red stars show the municipalities that have adopted a nicotine-free generation birth date phase out. And the yellow stars represent places where we are having success in discussions with the boards of health in those jurisdictions. And if I look at the next slide, which let's see, let me go. Okay. If I look at the next slide, you can see that does extend across the state. It's just that most people in Massachusetts, the most population is in this area. Okay. So just to talk through the timeline, the town of Brookline was always friendly to tobacco control and had done some innovation earlier or been an early adopter of smoke-free restaurants, for example. In May of 2021, Anthony Ishak and I led an effort to bring the birth date phase out to Brookline, and we knew going in we had the support of the Public Health Advocacy Institute at Northeastern Law School, and that was very important because it went into effect in September 2021, and predictably there was a legal challenge. The industry challenged, or a bunch of retailers challenged the law, but in March 2024, the Massachusetts Supreme Court upheld the law as both consistent with state processes for passing tobacco regulation and as constitutional. So once that happened in March of 2024, we began bringing the idea to local health boards. And in May, we managed to see the adoption in 4 towns, and in June in 2 more towns. Both of those all of those were jurisdictions just north of the city. Then, of course, because it's Massachusetts, we take the summer off, and in October, it was adopted in Concord, and we have upcoming hearings that are quite hopeful in 3 more jurisdictions. And then in November, hearings in 2 more jurisdictions and a vote in yet 1 more. And then a bunch of towns that are looking at it with an ultimate goal of getting the number of jurisdictions up to enough that the state feels that there's buy-in from municipalities, that consistency across the state would be a good thing, and that this is workable, which it is so far showing that it is. Okay, so factors that influence which municipalities we've brought this in front of. I think the most important is an interested tobacco control program manager. We have a number of these in Massachusetts. They tend to cover maybe 6, 7, 8 jurisdictions with 1 tobacco control program manager. And we've had a few who are very, very interested in getting their jurisdictions to pass this. And I think the first 4 factors are all related to the energy of the tobacco control program manager. And one in particular north of the city, Maureen Busby, has been quite helpful. Another thing is that if a municipality has an active enforcement and compliance check and cessation programs, if they're already enforcing what they do, again, that's likely to depend on an active tobacco control program manager, but then they're going to be more receptive. Likewise, if they've been leaders in other tobacco control policy, like 21, raising the age to 19, then 21, the pharmacy bans, retail license caps, and so forth, they're more likely to find this interesting because they already have that culture. And in a related matter, that they're quicker to adopt with the more routine tobacco control that's going on in Massachusetts, including capping permits. This, under state law, our local boards of health have the authority to adopt this policy. And so interest in the Board of Health is really important. Also, just getting people to show up and advocate and communicate with the board members has been really influential. And then finally, the number of retailers in the municipality and their own level of organization to oppose this. On the other side, what is it that we encounter that are our kind of risks or barriers? I think one of the big ones that's potentially interesting to this audience is entanglement with the harm reduction in vapes question. And because we are a nicotine-free policy. And I think we've been trying to address this at the board level by noting that even if transitioning from combustibles to vapes does turn out to be a harm reduction measure, our population that we're protecting doesn't use either. So ours is unaffected by the vapes harm reduction debate because we are trying to protect the next generation. Often there are other nicotine and tobacco issues that an active board is interested in, including endgame strategies like curtailing retail altogether, or caps that are other commitments that an active board might have. Every single hearing, we hear about the cannabis environment in Massachusetts, that it's possible to buy weed, and therefore it should be possible to buy nicotine. We, of course, point out the difference in the level of harm and the difference in the level of addiction between the 2 substances. But it's just something that repetitively comes up. And then organized opposition. You know, the Retailers Association has a robo email operation, and they often are flooding boards of health with emails opposing the policy. We've had Retailers Association representatives at every Board of Health meeting. They come and they testify. We've had shop owners at every hearing. And I think it's important thing that we point out that they will not lose any existing customers. They only lose the next set of customers who might be coming up. And in Brookline, no shops have closed. And then often we will see a select board or other political leaders who are concerned about their retailers and the health of their retailers. So that's kind of an overview of what we are doing. And we are hopeful, cautiously hopeful, that we will be able to get this to a state level sometime in the next maybe 12 months.
That's exciting to hear. Thank you so much for sharing, Kate. It's very encouraging to see everything happening in Massachusetts. We'll now turn it over to Hazel to hear more about what's happening in the UK on the Endgame.
Thank you. Let me see if I can get this slide up. How's that looking?
Perfect. If you can hit presentation mode, we should be all set.
Doesn't want to work. There we go. Hello, I'm Hazel Cheeseman. I'm the Chief Executive at ASH in the UK, and I'm going to tell you a bit about where we've got to with our smoke-free generation legislation, which is part of a broader bill, which I'll also touch on as I go through, and the aspirations of the current government. So I'm going to start with a little bit of a UK recent history lesson, also known as sort of how to have 4 prime ministers in 2 years, because it's been kind of a turbulent time politically in the UK, and that has had some interesting implications for how our smoke-free generation policy has developed. So some people may be aware of our Prime Minister between 2019 and 2022, Boris Johnson. So much could be said about Boris Johnson, but one of the things that happened under his premiership was that the then Secretary of State for Health commissioned a report about how the government could achieve a goal that had been set under Boris Johnson's predecessor for the country to be smoke-free by 2030. So they commissioned this independent report from Dr. Javed Khan, which set out a comprehensive range of measures which the government should take if it wanted to achieve that goal. In that report, he pointed out that he felt that a 5% ambition was insufficiently ambitious, and really the government should be looking to make smoking obsolete altogether. And in particular, he called for a smoke-free generation policy, a phased-out sale of tobacco to the next generation. So the Khan report was published, and then literally sort of moments later, Boris Johnson resigned. So it felt that this exciting opportunity felt as if it wouldn't progress. We then got our next Prime Minister, Liz Truss. She was not with us for so long, which was fortunate because her Secretary of State for Health here, Theresa Coffey, is a heavy smoker and was unable, when asked by journalists, to even say that smoking was bad for people's health. So it felt for a brief period as if no progress at all would be made on addressing smoking and working towards this ambition of a smoke-free generation and a smoke-free country. However, as I say, famously, a lettuce outlasted this particular Prime Minister, and we had our next Prime Minister, Rishi Sunak. So Rishi Sunak came in with a much more sober agenda than the previous Prime Minister, and with a particular interest in the health of younger people. And he used his conference speech, his party conference speech, when he speaks to his political party, the members of the Conservative Party, to announce that he would be adopting this key measure that was raised in the Calm Review, the phased out sale of tobacco to the next generation. And this was something of a surprise because the Conservative Party in the UK is our party of the right, and Rishi Sunak was certainly a prime minister from quite far right within the party, and for him to be advocating for this legislation was very exciting. I'll talk a little bit more about the progress of the bill, but we had it got so far, and I'll talk a little more about that. And then we had another election, and now we have another Prime Minister, Keir Starmer. Hopefully, he might last a little longer than a lettuce, and he has also committed to this vision of a smoke-free country and to the smoke-free generation legislation. So what's very exciting, I think, for us, and what is different from what happened in New Zealand, is that this is a policy that was proposed by the party of the right, has been adopted by the party of the left, the Labour Party, who Keir Starmer represents. And so it has this strong cross-party foundation, and it is to be hoped, therefore, that we won't, when we finally manage to pass this legislation, suffer the fate of New Zealand and see the legislation rolled back when the party of power changes. So just to give you a bit more context over what this legislation was. So the Tobacco and Vapes Bill, which was the bill that was brought forward under Rishi Sunak, it proposed this generational ban on the sale of tobacco for those born after 2009. But it wasn't the only thing in the bill. There's also quite a lot of additional powers in relation to regulating the promotion of vaping products and the branding of vaping products and so forth, and additional enforcement powers that relate to both tobacco and vaping products. So it was a bill that was about tobacco as a kind of, I guess, the exciting, shiny policy to create a smoke-free country, but then also some sensible additional powers to further regulate vaping products to reduce their appeal to young people whilst keeping their availability there for those smokers who want to switch. Alongside that, we have a disposable vapes ban, that should say, not a band. This is under our environmental regulations, and we think now that probably this will come into force a little later than April 2025, but is still likely to come into force in 2025 and will prohibit the sale of disposable vapes. And HMRC have also, our Treasury has also consulted on a tax on e-liquids. They've said they will keep the price differential with tobacco. If they bring that into force, that will come into force, we anticipate, from October 2026. So, just to give you a sense of the landscape. So this legislation has been very, very strongly supported by across the health sector in the UK. It is UK-wide legislation. We won't get into describing all the different devolved situation in the United Kingdom. This legislation would be UK-wide, and it's strongly supported across the country. So this is what happened. We passed the bill, or the bill got through first reading, second reading, and it completed its committee stage. So it had almost completed its passage through our first house, through the House of Commons, but it hadn't quite made it into the House of Lords. And so therefore, when the general election was called, it was unable to get through. But what you can see here is that the different colours represent different political parties in the House of Commons at the time that the legislation was debated and had a vote at second reading. And there is truly cross-party support for this measure. So now we are here under a new government. They have committed to bringing back the bill. Just the day before yesterday, our Secretary of State for Health, our new Secretary of State for Health, said we should see the bill before Christmas. But there's also an intention by this new government to strengthen this legislation for it to be to contain more measures than the previous government had intended. So we think that will include leaks in the media suggest that will include an extension of our smoke-free legislation to include outdoor places, and extensions around some of the prohibitions on vaping. So, for example, to prohibit vape vending machines. And it may well introduce additional regulations around the licensing of tobacco and vaping retailers as well. So it remains to be seen when we see this new legislation. But our new government, the Labour government, have also said that they don't just want to create a smoke-free generation, they want to create a smoke-free country. They have kind of taken up the mantle of what was in the independent review, the Calm review, which said that the 5%, that's not sufficiently ambitious. We need to make smoking obsolete. And they have said they want to set out a roadmap to a smoke-free country and see a vision for rapidly reducing rates of smoking across all populations. So what that means in practice, we still are keen to see. But at the very least, we would like this government to at least commit to the funding that was put in place by the last government, because when they brought forward legislation, they also committed to new funding for our local authority stop smoking services that complemented existing funding that was already supporting people in the community to quit, with funding to support smokers in our National Health Service, in our hospitals, our mental health hospitals, and in our maternity pathways. We had a swap to stop scheme in place. It's currently only got funding to the end of this financial year. This is about providing people with access to vape starter kits as a way of helping them to stop smoking. New funding around enforcement, mass marketing campaigns, and a financial incentive scheme for pregnant women. So we hope at the very least, when the Labour government publish their spending review, which is coming next week, that we'll get this reinforced commitment to additional spending. But we will also be calling, as a public health community, have been calling for a levy on the tobacco industry to properly resource all of the support that is needed into the future to realise the vision of a smoke-free country. So where next? We hope to see the bill very, very soon. Once the bill is passed, we will then have further work to do to define these new vaping regulations. We will need to make sure that the new legislation around the phased out sale of tobacco is effectively communicated and effectively enforced. We want to make sure that the investment is there to support the number of people, to reduce the number of people that are currently smoking as part of this roadmap to a smoke-free country. And hopefully the government will realise that vision. I will stop there.
Great. Thank you so much, Hazel. That's so interesting. And we're definitely very hopeful to see some progress before Christmas. Before we hop into the Q&A, I just want to share some resources that are available to folks and upcoming webinars. But while I'm chatting through this, we invite you all to pose any questions you have for the panelists in the Q&A box. We have a good amount of time still here today, so we hope to be able to answer any of your questions on the Tobacco Endgame. I wanted to remind folks that ASH has this Tobacco Endgame Policy and Advocacy Training course online. This is a free course. There are 9 recorded lectures that you can go through at your own pace. And in addition to those recorded lectures, we'll be hosting live discussion sessions with different experts. Those live discussion sessions will kick off next month, so you have some time to start the different lectures in advance and prepare yourself for the live discussions. We're putting the link in the chat for you, so definitely take some time to register and check that out. We also have an upcoming webinar on October 29th that is being hosted by several of our global partners in preparation for the next round of negotiations for the UN Treaty to End Plastic Pollution. So the webinar is called Road to Busan because the next round is in Korea. But we invite folks to register for that as well and hear about our upcoming priorities and why it's time to ban cigarette filters. You heard Chris talk a little about Santa Cruz in California that's already doing it, but we obviously hope to do that on a larger scale as well. So we'll include these links in the thank you email too, but I just wanted to make sure everyone had a chance to know about upcoming webinars. And then the next webinar in ASH's series will be Tobacco Control Advocacy at CEDAW, the Committee on the Elimination of Discrimination of All Forms Against Women. And so we'll talk about our work at CEDAW in the past, present, and future. We have colleagues Laurent and Kelsey who are normally on these webinars with us. We're at CEDAW this week in Geneva, so you'll be able to hear about what they were doing at CEDAW and our plans going forward. So that webinar will be next month. Again, you'll be able to register in the thank you email, but I just wanted to make sure folks knew about that because we have a ton of webinars coming up for you all to attend. So we'll kick off on the Q&A session. Chris, why don't we start with you? And if folks are joining the webinar today and interested in kickstarting their own endgame policy in their local community, what should their next steps be?
Well, definitely reach out to ASH. We have a lot of resources both at the ASH main site and in our California Endgame site, and I'd be happy to sit down and chat with anyone about putting together a strategic plan. This is something that's happening at the very local level in the United States, and so the context is going to vary wildly. So there's no one size fits all, but there are a lot of people have been thinking about this. There are a lot of examples from around the country, so I'd be happy to go over those with anyone.
Fantastic. Thank you. Hazel, it looks like we have two follow-up questions that came in during your presentation. The first being, how are e-liquids currently taxed? So I believe that was directed to you because you were speaking when it came in. And then do you think PM Starmer would be willing to ban tobacco companies from sponsoring sports teams? I know that was in the news recently with F1.
So I'll start with the how vape tax. So we have a sales tax, what we call VAT on vape. So just taxed in the way that most other products in the economy are taxed. So the proposal is to introduce an additional excise tax. The benefits of that would be there'll be a couple of benefits to that from our perspective. So first of all, an excise tax conveys additional powers to our border force and our revenue and customs officials to be able to stop products which don't meet UK standards at the border. So we currently have a little bit of we don't have quite enough powers to address some of the illicit products that we're seeing in the UK market. So that would be, having an excise tax just of itself conveys additional powers and additional resources to address that problem. And then we also do want to see the cheaper products, the kind of very kind of entry-level products that might be appealing to youth and to non-smokers made more expensive. As I say, the government has been explicit that if they introduce this additional tax, they will keep a price differential with tobacco. So it's kind of always cheaper if people were switching from smoking cigarettes to vaping, that would always be a cheaper option for them. But raising that tax somewhat is something that we would welcome. On the sports sponsorship, I mean, we have comprehensive advertising restrictions, which include sponsorship. So and F1 was much debated under the last Labour government when the comprehensive advertising regulations came in. It took a little longer to implement them for Formula One, and it was quite controversial at the time. But yeah, so as it stands, we don't have tobacco advertising or sponsorship in any form across the United Kingdom.
Great, thank you. Kate, we'll hop over to you. The momentum that you shared in Massachusetts has been amazing. What are your top needs from the rest of us in order to keep going?
Oh, thank you. What a wonderful question, Megan. We have really been operating as an informal group on a shoestring. There are professionals in our group, Jonathan Winikoff at Harvard Medical School, Mark Gottlieb at the Public Health Advocacy Institute, and Maureen Busby, who's a tobacco control program manager in Massachusetts. So we have some people in our group who are professionals, but everybody is tacking this onto their existing job. And a number of us who are involved are just interested in the success of the movement. I think the most important thing that we could get is the normalization of the discussion of the birth date regulation. And the birth date regulation sort of being folded into all endgame conversation, along with the idea of shutting down sales altogether. So I think if we could pull on board major national groups, that would be really helpful to us. I think we're also going to need something at the local level, some sort of more formal leadership and organization to get through the state level. Because right now, we're a people-powered and we're at the local level. And that's where people power really works well. But when we get to the state level, it feels like we're going to need more professional support, maybe from Ash.
Can you speak a little more to the state level interest? We'd obviously love to hear
Yeah.
about what you think it would take for that as well.
Yeah. The story in Massachusetts is similar to some other states, California, for example, in that the state law allows localities a lot of leeway to regulate tobacco and nicotine products. Not every state is like that. So not everybody can choose the path we're choosing. But because we do allow local regulation, there is a well-oiled path, if that's a mixed metaphor, for arriving at statewide legislation. And we have seen it with, ranging from smoke-free restaurants to removing nicotine from pharmacies to flavor bans to the 21 age. And the process is this: a number of municipalities adopt it. And then at some point, those municipalities provide both evidence that it's workable and some political cover at the state level because they normalize it, and some feeling at the state level that it would be helpful to create uniformity. Because one issue for certain with a more restrictive nicotine regulation in one municipality is that you're concerned that customers will go to another municipality, and while they're there, they won't just purchase their nicotine, but they'll also purchase their gasoline or their newspapers, if people still did that. And so you want to make sure that you're not harming your municipality as against your neighbors. Now, what I would say is that there are a few state reps who represent the jurisdictions that have adopted it, who are quite interested in this reform and have an eye on it and have been supportive and are meeting with us. And the message that we get is get some more jurisdictions. And that's what we're working on.
Fantastic. Okay. Hazel, there's a question if you could clarify if the measures apply to just England or all of Great Britain and Scotland. And then folks are also interested in what the key arguments are that you've seen from the tobacco industry and how you've been able to counter any of those arguments that you're hearing.
So the core policy, the Smoke-Free Generation legislation, that is a UK-wide policy, so it would relate to all 4 nations across the United Kingdom. And the vaping regulations would similarly apply. There's a bit more complexity with some of that. For example, things like point of sale display have a devolved competency, so some of those regulations might be produced in the individual nations. But what the UK government is doing is they are operating on behalf of and with the consent of all of the 3 devolved administrations that we have in the United Kingdom, Scotland, Wales and Northern Ireland. So they are, in the case where they are regulating for things which are UK-wide, they're doing that as they normally would. And then for areas which there would normally be devolved competencies, they're taking the powers, and then further regulations will be produced locally. So it's a bit of a mixed bag, as these devolved issues often are. And then the other question was, sorry.
The key arguments that you're seeing from the tobacco industry and how you're countering those.
Yeah, so I mean, it's funny really. When the Prime Minister Rishi Sunak, when he made his conference speech with this very, seemingly quite shocking announcement that he was going to back the phased out sale of tobacco. It had a moment of kind of excitement and controversy, and certainly we saw pushback around, this is a question of like freedom of choice. There's a kind of slippery slope here. The illicit, all of the kind of old chestnuts around, oh, well, it will just cause an explosion in the illicit trade. Oh, and it won't work. All of the old stuff that we always see whenever, whatever tobacco regulation you're advocating for. But what's been so interesting over the intervening time, and it's been about 12 months since Rishi Sunak made that announcement, is that this policy has sort of been divorced of any controversy. It's barely being discussed in the media at this stage. The thing that has attracted much more controversy in the public debate recently is the plans to extend smoke-free laws to more outdoor settings, which has attracted much more public debate around the impact that it might have on our hospitality sector. And so, to some extent, the fact that it's been cross-party, the fact that it looks like it will happen just a matter of time, it's just a matter of parliamentary time. It seems, and that the tobacco industry does not have an enormous number of proxies who are going out to bat for them on this particular issue. It honestly has not attracted anywhere near as much debate, either in Parliament or in the kind of media space, as you might imagine, given it is, a fairly radical policy.
Well, that's fantastic to hear. Chris, have you heard any strong tobacco industry arguments that we've had to counter for other endgame policies? I know in California, we're not looking as much at TFG policies. They're more the phase out, or in Australia, where we did have the industry slow down a policy there.
Yeah, it's been fairly interesting because obviously this is Endgame is a death sentence for the tobacco industry, and I think that's one thing we all need to realize in our field. And it took me years to realize it, and I think some people still haven't. We can't have an end to the tobacco epidemic and a tobacco industry. Like, one of them has to go, and the industry gets that more than anyone. I think in terms of Endgame, they're still sort of hoping it goes away, and that this is a phase that will just fade out. And I think one thing to look at is that they sue multiple times over flavors and menthol, and they sued Brookline, but the two places that have just simply ended tobacco sales altogether have not been sued. And I think there's probably two reasons for that. One is that they have no chance. All the arguments they make when it comes to menthol and to tobacco-free generation don't apply when you just ban everything across the board. There's no equal protection argument. There's no picking winners and losers, and that's not what the government's supposed to be doing. But I think the other reason they haven't sued is they don't want to draw attention to it. And a lawsuit would make everyone realize that this is possible. And the number one challenge that we have faced at ASH and with Project Sunset, domestically and across the world, is that people aren't aware this is possible. When they're made aware of it, it is wildly popular. And we get polls back from Spain and France, for instance, when they asked about tobacco-free generation. 86% of Spaniards and 84% of French adults said that they were in favor of it, in spite of the fact that they have a 22% adult smoking prevalence rate. Most people that smoke want these laws to come into place. They just aren't aware that it's possible. 2 years ago, the CDC included questions on Endgame in an annual, very very large public health survey. And when they asked if people thought that we should ban the sale of tobacco products immediately, 57% said yes. We can't get 57% of people to agree that the sky is blue in this country at the moment. So that says something. I think that is the tobacco industry's biggest fear, is that people will understand that this is something that governments can do, because when they think about it, everybody wants it, but they haven't thought about it because it's as much a part of our society as milk, right? It's just something that's always been there, and people can't imagine that it goes away. I think if this spreads more, the tobacco industry is going to have to come out fighting. Right now, they're relying on retailers, and the poor retailers, you're hurting them. But when it gets bigger, they're going to have to get more involved, because it is a death sentence for them.
Absolutely.
I wonder if I could come back, because I think
Yeah.
that the way that the tobacco industry were trying to avert that kind of death sentence, as you described, Chris, was that they were trying to get carve-outs in the legislation under the previous in the previous government. So the law would cover all forms of tobacco, So heated tobacco, oral tobacco, it would cover all forms of tobacco. And so they were going in and they were having some traction with a very small number of parliamentarians, that it should just apply to tobacco. It should just apply to the most lethal combusted form of the product, and you could leave the heated tobacco alone. And it didn't get enough traction in the last parliament, and it definitely won't get enough traction in this new parliament, which is much more left leaning. But I think that will be again one of the tactics you would expect to see the tobacco industry deploy around the world. Is okay, all right then, maybe take the cigarettes away, but you can leave our heated tobacco, you can leave the oral tobacco, whatever it might be, and that's where they'll be looking for opportunities to limit the death sentence, as Chris says.
Yeah, that's really interesting. Kate, are there any industry tactics that you all have seen, especially since they lost the lawsuit in your area?
Yeah, I mean, I think that first of all, having the retailers sue and the retailers show up is supported by the Retailers Association. And the Retailers Association, I suspect, is supported by the industry. In other words, when Chris says they're going to come in, I suspect they're already with us. One thing we've been hearing it recently, as in the last 3 or 4 weeks, is an effort by that advocate to get a board to postpone a decision pending research. So this is new. We weren't hearing this most of the time. And of course, there's no research because, I mean, people are interested in doing research, but almost all of these jurisdictions aren't implementing until January 1st, 2025. So there would be no ability to research. We have some parallel research, on distance to retailers, impact on tobacco 21. But I think asking this request of boards of health is an effort to kind of slow this forward moving progress. So we are seeing that. And again, I would return to the fact that we hear a lot about, in Massachusetts, many of our retailers are immigrants, people of color, and they might be one of the few immigrant-owned businesses or one of a handful of immigrant-owned businesses in a jurisdiction. And so they have a compelling case that there may be a question of how friendly the jurisdiction is to their businesses. So I think that's one thing that we've been hearing. And we've been presenting a lot of information about the negative impact of nicotine on communities of color and low-income communities in particular. So we've been hearing those things. And as I had said earlier, we really do hear a lot. We hear at every single hearing about cannabis. And we've been just trying to separate ourselves from that, because at the political level, first of all, they're so different as a matter of health. A person can 100% think they're both problematic, but we don't want a board of health to feel like they need to run them in parallel. And so we provide the boards of health information about the differences between them, both in addictiveness and harmfulness, and usefulness. So, and on all those metrics, but we do hear about it every time.
Thank you. I was just going to ask if you could address the medical marijuana and legalization issue. Chris, can you speak to your experience when you're reviewing Endgame in different countries? What are the normal prerequisites for a country to successfully start and implement Endgame policies?
Sure. Let me start by saying every context is different, and that's one of the reasons that that Project Sunset and Ash, we don't press for a single silver bullet policy, right? It's gonna vary, and there's been some publications recently that have called into question the NFG concept. It's great in some places, and in other places it might be too weak. There are cities in California that are on the verge of banning sales altogether. Why would they go to NFG? And there's other places that are not nearly ready for NFG. So sorry just to put that context out there. It's going to be different everywhere. But I would say the number one prerequisite is full implementation of the Framework Convention on Tobacco Control, which is mostly demand side interventions, but it has been proven to reduce drastically prevalence in countries that implement it fully. And once you get the prevalence down to that low, not only does it make it easier to do an end game, it also makes people kind of yearn for it because they're like, we're almost there. We've made all this progress, and yet, if you look at a country that's gone from 25% prevalence to 10% prevalence, they're still going to lose over 5% of their population to an avoidable death. And I think that's the thing we need to keep in mind, that no matter how much progress we make, it is still a public health a public health emergency in some cases. Now, I also saw a question about how this is going to work in lower and middle income countries, LMICs, and that's a huge question because their context is quite different than the places that have passed or are considering passing endgame legislation in more developed countries. We have been working with folks around the world on this. There is a Project Sunset Global Steering Committee. I co-chair that with a researcher, Marita Heffler in Australia. There's a paper came out recently that looked at the readiness of lower and middle income countries to do endgame, and they came up with about 20 countries that they feel are out at that point where they can move. And so I'm currently in contact with about 6 LMIC countries that have domestic civil society organizations that are very interested in pushing this forward. Now, of course, resources are always going to be a problem there. We just heard about the amazing work being done in Massachusetts by basically volunteers. That's going to be hard to replicate in a lot of lower and middle income countries where people don't have good jobs to begin with. They can't just add on to it all the time ad nauseum without getting some more funding. So we're talking with some of the global funders about potentially getting some resources. It doesn't take much. It doesn't. $5,000 in a lower middle income country can go a long way. But we need to get that funding stream going. But there definitely is interest, and there are definitely policy options available for where the political will exists.
Great. Thank you so much, Chris. I know we're getting tight on time, so I want to turn it over to each of the panelists for any closing thoughts. If you do have a question, though, that didn't get answered, feel free to email us at info@ash.org. We're happy to coordinate with the speakers to address any outstanding questions, or if you're looking for technical assistance on Endgame, definitely reach out as well. So, Hazel, why don't we start with you? Any final thoughts you have today?
Oh, it's very exciting to be here and to be on the kind of verge of taking this forward in the UK. So thank you so much for the invitation. I think that the lesson, hopefully, from the UK will be that the opportunity that comes from getting unexpected people to support tobacco control policy, to have the party of the right and the party of the left so squarely behind this objective, I think will be really, really crucial to its success, both now and in the future. But also that it's not a policy in isolation. And I think that goes to what Chris was already saying, that, the comprehensive approach that we've taken over many years in the UK has been really important to get us to this point, but it will continue to be really important to get, to go that last mile, to get the 6 million people that are still smoking in this country to stop and truly make smoking obsolete. So it's great that we're here, and I hope that we'll be able to come back and say, here's the progress that we've made in a couple of years' time, and that it will be alongside also reducing prevalence among our existing smokers.
Absolutely. We're excited to see the progress continue to grow. Kate, any final thoughts from you?
Yes, 2 quick ones. The first is that the birth date regulation is relatively new, even globally, and I think it isn't always immediately understood when you talk about it. And I find that it takes a while when speaking with someone who's very interested in public health to convey just how it operates and why it's important with respect to addiction and so forth. So I think that the more people talk about this regulation, the better it would be, because I do think that we still need to do a lot more to kind of get the idea into the bloodstream. The second thing is that I would encourage anyone thinking about a birth date regulation as opposed to different kinds of endgame to include all nicotine products. Because again, I just want to emphasize again that while it may make sense for somebody to adopt a permit or a sales ban on combustibles with the hope that people will transition to vapes, there's no reason for somebody who currently cannot be sold and does not use to come into nicotine use. So our population that we're working to protect with the birth date regulation is not yet using any nicotine products, and ideally we would remove them completely.
Great. Thank you so much, Kate. Chris, any closing thoughts?
Yeah, just a few quick ones. So first, I want to, for folks that have been working in tobacco control for years and years, this can still seem radical, but I would put forward the proposition that the radical thing is that this stuff is still on the market. No other industry gets to sell something that is highly addictive and kills when used as intended, right? If a new product came out tomorrow that was like that, not only would the product be removed, the people that put it on the shelves would be criminally prosecuted. It's basically, in my opinion, murder. So the radical thing is that we've gone 70 years living with this. It's time to get rid of it. And second, for folks that are in jurisdictions that they don't think and maybe are not ready to do Endgame, that make the plan. I think that's what's very key. And a great example is Spain with 22% prevalence. Their national coalition of civil society organizations 2 years ago put together a 10-year plan to submit to the government that if you do this and then this and then this and then this, in 10 years, we will be ready. But just not giving up is not an option. Put it in your long-term plan. And then finally, I have a plea for everyone that works on tobacco and deals at all with the media. Please do make sure they understand that this is about banning or phasing out sales, not smoking. More than half of the articles that come out talking about what's going on in the UK or in Massachusetts or in California talk about such and such a jurisdiction planning to ban smoking. No one is talking about banning smoking. This is about the industry, not their victims. And when you talk to the media, make that upfront because it's really frustrating to have to fight back against something that's not actually happening.
I couldn't have said it better, Chris, that the ban smoking headlines are, I think, a pet peeve of all of ours. So I think that's a great message to end on. We thank everyone for joining us today. Look out for our follow-up email. We'll include the recording to today's webinar, as well as the slides and links to follow-up webinars and the Tobacco Endgame training course. So feel free to reply to us if you have any additional questions that weren't answered today or are looking for technical assistance with the Tobacco Endgame. Thank you all for joining us, and we will see you next time.